In other news.
Yeah, and anyway, good morning. I'm Chris. I'm the guy who's got to move on after Jason says stuff like that. Right here on the link, it's 7:05, Wednesday, September 15th. Speaker Terlahi's coming up. Superintendent John Fernandez. We also do the Greater Good on Wednesdays. Jay, we're going to tell you
about a shoe drive that former Senator Kelly Marsh Taitano and her sister are putting together and everything. And they really need your help because we really got to distribute footwear to our island's needy. So stay tuned for that because that's coming up.
right.
It's going to be good.
It is. It's 7:06 now. Let's head into the KUAM News Zoom room where we have the acting chief public health officer for the Department of Public Health and Social Services, Chima Mbakwem. Good morning, Chima.
Good morning, Chris.
Good morning. So I know you've already had a pretty busy day, right? Do you care to share with us? Because you said you've been up since 3 a.m.
Yeah, I had to attend the National TB board meeting this morning because we're still looking at the impact of TB and COVID across the United States. So I'm a member of the National TB board. So we talked about the impact, and it's really impacting, heavily on TB because of late diagnosis.
So what's the impact?
Yeah.
It's being seen everywhere, because of people are delaying diagnosis, and most people are still in quarantine, and transmission is always high at home for cases for airborne diseases. So we're seeing an increase in numbers of cases across the U.S.
How about in Guam?
Yeah, it's same too, But what happened with us was at the beginning of the year we had an increase in numbers because of late diagnosis, but I think we've actually peaked now, so it wasn't as bad as it was. The numbers we saw at the beginning of the year was higher than we normally see over the years. But
was COVID the reason for the delayed reporting? Because maybe people thought they had COVID instead of TB.
No, I think it's just the delay in assessing healthcare. People were not going to the clinics because of COVID, so there was late diagnosis on the part of the doctors.
I see. So what happened with the Regenco?
Oh, the FEMA team. Yeah, the team's arrival was delayed, so I think they're going to come next week. Yeah.
Any reason for the delay?
Like it's a FEMA related delay, not us.
Yeah.
We made the request. They actually gave us a timeline, but they were also saying, it might shift, but that was a tentative date that they had planned, but they were like, it could change, and it changed. So we were notified that things could change because of what is going on stateside. So,
right.
but it doesn't really affect what is going on at home here, because the team is actually coming to support what we're doing. So already we have the sites going on. It's just the support with additional sites. So while we're still doing what we're doing, we'll still expect them to arrive next week.
So then does that mean that the infusion center over at the Mangilao Senior Center is opening as today?
Yeah, we actually discussed that yesterday in our meeting. You see, the thing is, we have manpower that we can move to the site, but we also have to consider the fact that we're going to move manpower from one site to another. So we really have to balance those decisions. But the fact remains that the treatment is ongoing. It's just an additional site, so to get more people on the treatment.
So is the Mangilao Senior Center, the infusion center, opening today as planned? We were told it wasn't, but
no, it's not going to open. No.
Okay. And so can you kind of explain what's happening with the shipments of Regenco? Because we were told that there were some temperature control issues. That was from public health. But then I'm wondering if it was part of the shipment that GMH received over the weekend, the 168 or 100 something, and 140 of them were deemed unusable because of temperature control issues, which left 20 vials salvageable for GMH. But I didn't know if this was the same shipment that some were supposed to go to public health.
No, so this is not a public health shipment, no. So our own shipment was actually placed, I think last week, and we're expecting it anytime this week. So that the shipment that came wasn't the one from public health. So I don't have any information about, what transpired.
Chima, how much of an impact is this delay in rolling out the Regencov infusion center is going to be? Because, when the governor had her press conference, the gist of it, the thing I took away was that we're not doing any more strict restrictions because we have this great treatment for everybody who tests positive.
Mm-hmm.
Right, but I feel like every day we don't have this treatment stood up is another day that people can get sick and go into the hospital. So, how are you guys gauging the impact of this delay? I mean, I know you want to downplay it, but I mean, it seems like a big deal.
No, Chris, it's not about downplaying. You see, the thing is, I've always said, there are layered protection. So first of all is, if we quarantine and isolate people who are infected, there won't be new transmissions. If we continue to get immunization, it will reduce hospitalization. Then with the treatment. So now we already have the treatment on island, but it's about expanding the treatment. But at the same time, we want to expand the treatment, we're asking people to, wear their mask and stop new transmission. So this is like a three-pronged approach. We're encouraging immunization to reduce hospitalization. We're asking for protective measures to reduce new transmissions. And at the same time, we're offering some palliatives, for people who are infected. So one does not, supersede the other. They all have to work together. So this delay does not mean that we are not treating people, but what it means is that we cannot have an additional site, like we planned. But at the same time, we are increasing immunization and also encouraging people to follow the protective measures that we have in place.
So are you able to, or are you not able to provide monoclonal antibody treatments today?
GMH and GRMC is providing the treatment, yes.
But not public health?
Yeah, and remember there's actually a timeline too. So for those that are infected, you have up to 10 days to get the treatment.
Okay.
So it's not like you just get tested today, you jump in and get the treatment. You're still eligible from the symptom onset up to 10 days. So even if they come in within, with the treatment that we have going on island, more people will be eligible, when they still come in. So I think it is a good balance. What the governor is putting out there is that, we have all these remedies out there now. Before we didn't have this. Before the only thing we had was mask, social distancing, lockdown. But now we've taken lockdown out of the table. We have immunization, and then we have a therapy. So I think it's a good balance.
I think what he's trying to get at is if there was only 24 doses of Regencov as of the weekend, do we have any left to continue to administer this monoclonal antibody treatment?
Yeah. I think the point was you're saying it's a three-prong approach, but it looks like we only have two of the prongs.
No, we have three. We have three. It's just scaling up the third one,
Yeah.
Before we didn't have it. Before nobody was getting treated. But right now we're getting treated. So, and you should also consider the fact that we are so far away, So it's not like you're going to fly from New York to Atlanta. It's not,
Yeah.
And, and there's also competing interests. So the good thing is that we are in that system. We are able to receive that treatment, which is good. Before we didn't even have a chance, to provide this kind of remedy to our people. But the thing is, let's not just look at that remedy, because if for you to get treated, that means you're infected. What we want is to stop people from getting infected. So if you get to the point where you need the treatment, you've missed the primary prevention, which is what we are trying to promote. People should stop new infections. It's just not about treatment, because when you get infected, there's a chance for mutation. There are new variants out there that could come up with new infections. So let us stop the infections first and make sure that people stop getting infected. If you look at our numbers, we are still testing high because people are still getting infected. So we should focus on, stopping new infections before we get to the point of treatment.
I was just focusing on the treatment because you guys made a big deal about how we're going to have this treatment. And I'm just saying, Chima, I know, but when we hear that only 24 of the shipment of 168 vials of Regencov made it to GMH and the rest had to be thrown out, then that means that we're only going to, that they're going to blow through that in like a day or two.
Yeah, but Chris, I think you should give credit to.
I do, I do give credit. I'm just saying, like, what's the, because this treatment is being held up as why we're not going to go into more strict measures. But, because of the shipping issues, which I understand might not even be you guys' fault, we're seeing this delay. Yeah, so obviously I'm concerned because people are dying at their house. You know what I mean? The people are dying at their house. Mm-hmm. So this treatment, it sounds like it's very important and very crucial, and it's going to be very helpful.
It is, and it is important because we've actually set up the site in Manila to start today. So, we are ready with everything. It's just the shipment, which we don't have any control over. Right now, we're ready to set the ball rolling. The press was there last week. The whole place is set up. The manpower is there locally. We just need the support and the medication. It arrived, but it wasn't the fault of anyone on Guam that it arrived that way. But that issue has been addressed. We reached out to Region 9. Even as of today, the regional health administrator for Region 9 HHS is on Guam. He's here physically. So that will tell you how much effort the government is making to get us that support. So we actually have the big guns on ground. So I think things will relatively change before the end of the week.
That's great to hear.
He gets to see firsthand the problem with what's happening with getting our shipments of Regencov to Guam.
Yeah, and they also have a subject matter expert for the Regencov on island too. So today we're going to actually move around the island to look at what else that we need to do. And having the big decision makers on island is an added advantage. Comparing what is going on in California, and he actually oversees California. You know how raging is over, the virus is over there, but we had that privilege of having him over here, to see firsthand and support what we're doing.
So has FEMA, the feds, whoever said that are bad? You had over 100 doses of Regencov spoiled because of shipping issues, which was our fault. Are they going to make good and say we're going to ship you even more to make up for the loss?
So, and I think that is so exciting to hear that you put it that way, and that is what is going on, because that initial shipment that came here had challenges, right? But now we're also looking at stockpiling because the shelf life is up to 1 year. So we're looking at getting more and keeping it on island so that we don't have to have this problem of we're having to wait. But that initial shipment was like the quick let's get it here right now to make sure that they have it on island. But the logistical process of having the medication on island is actually in place. So that's part of why he's here. We're looking at storage, we're looking at shelf life. So it's an advantage that we've also shown them that we have the capacity. So because a lot of jurisdictions are not even as quick as Guam, to set up a system to have the treatment. We have the tents ready, we have Manila already, We have the nurses ready. GDOE nurses are going to have public health. We ask for support from FEMA. So that means we are ready. We're just saying, can we have the medication? And then another good thing is that our testing, we never stopped our testing, because the reason is to keep on identifying new cases so that people who get infected would also get the treatment. And we're also looking at pushing it further as a post-exposure prophylaxis. So I think we're in good standing, moving forward.
We did have a couple comments here. Chima, what would you say is the reason for infection, and what needs to be done by the government to stop the spread of infection? To stop more infections is to place more restrictions.
So I think I pointed out initially that the route of infection is the mouth, the nose, and the eyes. 2, this virus is transmitted by human beings. So the primary responsibility, first of all, lies on the individual. Like both of you are wearing your mask because you're in the same room. I'm not wearing a mask because I'm alone in the room. If somebody walks into this room, the first thing I do is wear my mask. So what I'm doing is stopping myself from getting infected or infecting somebody else if I have the virus. That is the primary prevention strategy that we should have in mind, and keeping distance. So every other thing follows. If we lock down and then the people sit at home and for 2 weeks, the infection rate comes down. When they come out and they don't put on the primary prevention strategies that we have in place, the infection will go on. So it's more about consistency, accepting that this is a way, the new way of life, until we drive down the epidemic in such a way that transmission is minimal, hospitalization is low, so that people can actually live with the virus. But right now, the virus is not going anywhere. But still, we just need to make sure that we consistently put in human effort to stop transmission.
So you just really don't think that we need additional restrictions, even though the numbers, we're still seeing these triple-digit positives every day?
So I think what I can ask is, Sabrina, can you explain to me what kind of restrictions that you think we should have in place? You understand?
I'm not the public health expert.
What? Is it?
You didn't hear that.
I'm not the public health expert. I'm just saying, we had Dr. Wynn on yesterday, and he's like, he watched the press conference, and he said that was a nothing burger.
We
Like,
had
it was nothing.
but more importantly, we had Dr. Ann on last week, and we asked her, as an epidemiologist, would a lockdown work to stop the spread of the virus and lower the amount of new cases? And she said yes. So
yes, but we
know that the lockdown, there's a lot of political ramifications of it. I mean, we get it, but we're just asking strictly from a scientific standpoint, would it work?
So I think lockdown is more of a preventive measure than a scientific cure, in the sense that, first of all, if you are sick, it is going to affect you economically because you're not going to go to work. Your organization will not have you. It's going to impact on you as an individual because you're not going to earn income. Your organization is not going to provide service.
Yeah.
Your kids will not have the care that they need because you're not going to be there. So
right.
If we look at it from that point of an individual protecting
But that's not
himself,
what I asked. I asked from a spread of the virus scientific. I know and I understand the economic arguments, but just minus all that.
No, Chris, I'm answering your question about the economic impact of shutting down. You already have the impact on yourself by contracting the virus, right? You're not going to go anywhere. You're not going to spread the virus. That's what we're saying. So people should be consistent. Wear your mask. If you're sick, stay at home so that you don't infect anybody. Because the call for restrictions, is what level of restriction. That's why I said, if there's something that that I don't know, I'm ready to listen to you, because I'm saying Restrictions, what restrictions? What? We need to be very explicit in saying what restrictions, and then we look at what impact those restrictions would have on the family, on the economy, before we make those decisions. But the primary prevention is, if you are sick, stay home, cover your nose, stay and keep your distance, get immunization. So these things are there. So when I keep hearing, the restrictions, I'm asking, can you be explicit and tell me exactly what you want? Let us discuss all restrictions. Do we shut down the airport? Do we shut down the hotels? What impact? What data do you have to make those decisions? Those are the questions that we should ask.
Well, maybe you guys should give more data.
The data is out there, so that's what I'm saying.
Where's the data? On the public health website? It's so convoluted and difficult to read. We've been asking for the people that are positive, right? How many were vaccinated? How many were unvaccinated? For the people at the hospital, how long have they been there? We only get the GMH, the JIC report. All it says is unvaccinated, but you don't specify how many are vaccinated. We have to do all the math. We have to do the algebra, the geometry, all of that just to get information. And when you have the legislature, the legislative oversight chair, also asking for more data and not getting the data, and we can't even get straight answers from you, Chima.
So I go back to the same thing I asked you. What?
And I go back to telling you that I'm not the public health expert.
Yeah.
No. What? So we've actually.
Well, Chima, I think the point is really that whatever we're doing now is not working. It's just not working. So that's why we're coming to you and saying, what else can we do? Because you're the expert. You're the chief public health officer. I'm not. I mean, I got ideas, sure, but I mean.
So you don't think like the churches, they're 100% capacity. It's good.
No, Chris, you just mentioned someone, saying that, we need to add more restrictions. And like I said, I'm open to listening. I'm not saying I don't want to listen. I'm saying, I'm open to understanding, what restrictions, because if there's something, that that you can put out there, that can also make us think, differently. That's what I'm asking you right now, because the word that is being used is restrictions. We need more restrictions. We need more restrictions. What restrictions? That's what I'm asking, because first of all, we shut down the schools because we're trying to protect the unvaccinated from getting infected. That was the primary purpose. So that is restriction.
But then but then they were going to open them up, even though nothing changed. And so it's confusing. Chima, people are frustrated. They're angry. They're afraid, yes, of course, because they feel like we're hung out to dry out here. They feel like the governor just pops out and this press conference Monday. I mean, what was the point of it? To tell us that it's alarming? We already know that. We know it's alarming. And so people are expecting her to do something, because 7 weeks of... And these measures that she put in place that target the unvaccinated, they're simply not lowering the case numbers. And that's why people are frustrated, and that's why they are begging for additional restrictions, because at the end of the day, they don't want any more people to get sick and die. And so that's why we're turning to the experts. We're turning to the governor. We are begging, are you going to do something? If you're not going to do something, come out and tell us why this is okay.
Chris, and honestly, people are tired. People are sick of the COVID. People are tired.
Yeah, Chris, that's why they want to do something drastic to end it, or to stave it off, or to keep people from dying. That's the whole point. It's not hard to understand.
Chris, we're not going to take drastic measures for something that we cannot sustain. That's what I'm trying to explain is, it's being rational, in making decisions, and looking at how the virus is ravaging, just not one, everywhere in the world. Is the same everywhere, So is looking at what would apply locally. And like I said, what suggestions, what restrictions, what constructive, decisions can we make, as a community? Because I can self-isolate. Like I told you, from my office, I go home. I don't want to meet anybody. I don't want to get sick. You know, I take my vitamins. I've been doing this since last year, since February of last year. I've been doing almost 12 hours every day. My health is of importance to me, because if I get hit a second time, I don't know what's going to happen to me. So that is my personal way of taking care of myself. So I'm not going to go to a crowded event where I know that transmission can take place and expect to remain safe. So I think it's a mixture of personal decisions, following public health recommendations, and hoping that hoping that this virus would be lenient with us, and the whole world, because it's ravaging everywhere.
Yeah.
So when we're talking about restrictions, and like I said, I'm open to discussions. You have my phone number. My office is here. We sit down and have a constructive discussion about how to do it. Right. So because when I hear restrictions, I'm torn between, is it a total lockdown of the community? Are we going to stop visitors from coming into the island? Are we going to stop people from traveling? So the word restriction is so broad, being used at this time of the pandemic, because it can trigger a lot of things.
Yeah.
So,
And then, Chima, as well, it's like we didn't just start this yesterday, and people look at last year and they look at now, and people feel like we're worse off, even with the vaccines. And so when we look at what worked last year, that's why people are expecting some type of stricter restriction, whether it's closing the bars or reducing occupancy across the board, right? That's why they're trained to anticipate something. So people are not just randomly saying, oh, God, please lock us down. They're saying that because last year they felt like it worked. And so now people are looking around saying, hey, if this worked last year and we had all these deaths and high cases last year, then why aren't we doing the same thing? So you can't blame people for expecting you guys to do something more.
No, Chris, it's not a blame. And the good thing is that, when I sit down and talk to you and Sabrina, the conversation, I'm telling you, is very fruitful, in the sense that it's always balanced and objective. And listening to what you just mentioned now is like in our private conversations, that we have with our families, people are asking for some kind of, remedy.
Yeah.
Now you're saying the community is acceptable, to a lockdown. This was not what we were hearing, initially. But now you're presenting, that everyone is ready for a lockdown. This is good information. But at the same time, we also have to balance what we have in front of us. So it's good to hear both sides of the argument, and make a balanced decision. But your points are all well taken, But I still say that the conversations are good. I'm open to conversations. I'm open to suggestions. We can talk through this as a community. To look at what is best for us. Coming, not just saying the government. But as a community that the government is part of. For us to sit down as one and say enough is enough with this virus. Let us push. To stop this. So that, I think that's a better way to look at it.
So,
I'm acceptable
Chima, are you really not hearing any recommendations for additional restrictions, like closing the bars or the 100% occupancy on gatherings like at churches? Do you have that, Jason? Yeah. Okay, so we had interviewed the former head of the Physicians Advisory Group, Dr. Nguyen. He doesn't feel that a total lockdown should be implemented, but he does believe the governor should order bars closed. Businesses should be mandated, not voluntarily doing this, but mandated to go down to 50% occupancy with social distancing, to include churches. Funerals, aren't funerals like 100%?
Yeah, funerals are.
Yeah, so Chris, sometimes these things get lost in conversations, right? What you just said now, I didn't listen to the interview. I'm hearing it from you. So if that information is in front of me on a written piece of paper or in a text message, I can read and comprehend. I can understand clearly what is being said. I didn't hear this. I didn't listen to that conversation, right? I didn't know about it. But now you're telling me, I'm saying, okay, it's a good conversation, but let's sit down and look into it deeper. Let's look at it. What power does the the government have over the church. That is something that you need to discuss too. You know, there are court cases saying that the government cannot mandate the church. So, or are we going to take the concession to the church, or are we going to recommend to the church, you know, on what to do, but not mandating them to do it? So it's about how we approach, you know, these recommendations and make it work. You know, so I think that should be the balance. But I didn't hear this conversation, and I'm hearing it from you. But thank you for offering me that recommendation.
That wasn't my recommendation. That was Dr. the former head of the Physicians Advisory Group. But he is saying these are restrictions like need to be done like yesterday.
Weeks back, yeah. I mean,
but the virus is not the Delta virus is just not friendly. It is not.
Just not friendly, guys. That's the quote from this morning. The Delta virus, it's just not friendly.
It's not friendly. Yeah.
The mean guy.
He has defied every no. How do I put it?
All
It's
right.
just not friendly. Let me just
Chima,
not push it.
have a good day. Take a minute for
Thank you so
yourself.
much.
Do some meditation, you know. All right?
Yeah, I wish we can have a further conversation.
I can
about
arrange it. If
your
you want to come on
recommendation.
in a Zoom, we'll get someone to lead us in a meditation all together. It'd be like a good bonding thing.
I think I spend more personal time with both of you than I spend with a lot of people. I'm telling you. And that's Jason.
You don't gotta
yes,
sound so
Jason
mad
too.
about it, though.
No, actually, I think maybe what Chima wanted, he goes, Chris, let's go meet out on the soccer field, and we'll work out. We'll work it out that way.
I feel like my shins are gonna get kicked hard.
No, Chris will be on the same team. Thank you, guys.
Yeah, Chima, take it easy.
All right.
Bye,
All right,
Chima.
yeah. What was that Dr. Hull was talking about with the burnout?
Huh?
Remember he was
Oh,
talking about the
yeah.
frontliners and the
Yeah.
burnout.
Yeah,
I mean, it is just people are on the edge.
Okay, you want that quote? I got that right here. Okay, from our story yesterday during our interview with former PAG chairman Dr. Ho Wen. Quote, people that are at the front line, the policemen, the firefighters, the emergency room, the hospitals, the clinics. I tell you, he says, they're good-hearted, but at a certain point, they are going to break down.
Yeah.
Because nothing's being done basically to control the spread.
Yeah.
So.
And like I said,
We're
know
doing what we can, right, to control the hospitalizations.
Yeah, I get it. But the positive cases turn into the hospitalization, so it's got to go back to the measures. I mean, God, it's not. I feel like it's not that hard to figure out. But you know, there's huge political and economic reasons. But I'm just saying, like, what are we trying to do here? Are we trying to save lives? Because the economy is screwed right now. It is. I mean, it's unfortunate. And so what we're seeing is these decisions not being driven by what it's going to take to lower the cases and to save lives. Simply, that's not the main objective. Right? You heard it out of Chima when I said, hey, would a lockdown work? The first thing out of his mouth was say, hey, they're not going to be able to go to work. So there's these competing interests, right? But I'm just saying, if we're not going to do strict measures, which it looks like we're just not, I don't understand how this is okay day to day. And that's what the administration is saying. They're saying that this is okay. Every day, 219 cases. Go get a treatment that we're still trying to figure out because of shipping issues, right?
And again, those shipping issues are not the fault of the government of Guam.
Yeah.
So
Just so you know. Finally, something is not Gov Guam's fault. Yes. Finally. It was a federal issue. I guess like the feds arranged the shipping on their own, and they went through, I heard the manufacturer. And so that meant that we were out of the loop in terms of like, when's the box coming, right? Because I was thinking we were tracking it. You know, do you track your package?
Please say it's not stuck in Richmond,
Yeah,
California,
God,
like all the
please,
other
for
stuff.
real. Yeah, so that was a pretty interesting interview. It's clear, though, that they're not really considering any other types of restrictions. So that's that. It's 7:40. We're going to come
they're
back.
not listening to the community.
Yeah, I don't know. It's tough, guys. And that's why people feel like we're hung out to dry kind of on our own. And, guys, I mean, if we're not going to see the government mandate whatever, then just do it on your own, okay? 740.